Hi, my name is Santiago Villa Rodriguez. I talk to ways to improve the health system. What about the quality of the health system in Colombia? Although Colombia is an international example in the coverage of health service in the population, surveys show that Colombians are not satisfied with the system. Colombia is the Latin America country with the highest health coverage, expanding 95% of this population. However, 16% of affluents are dissatisfied with the service according to a survey by the Inter-America Development Bank. For this reason, different incentives are created for health provider entities (EPS) to improve care for their affiliates if they want to remain with the system. The form of the health system in Colombia is critical because their depths affect the province of the service. Since the EPS and of creating unnecessary tensions between the patients and doctors or institutions that prevents the service are recurring them in other countries as well. In Colombia, the use of new technologies and the population, for example, of telemedicine, robotization, and effects in clinical process should be implemented as we can see in the first image. In addition, models of economic and clinical sustainability results based chronic and risk based supervision, as we can see in the second image. Operational excellence programs should also be applied in clinical process, with which saving can be from 10 to 15% value-based contracting that is planned according to the results obtained to keep patents in better health standards and to make very strong programs for the control of corruption and fraud. Obviously, economic sustainability is only one part and it has to accommodate by more components as we can see in the third image. In some cases, it is not even necessary to invest more. The important thing is that the real problems are dealt with effectively and have machines that allow more effectiveness in the tasks that are carried out. Improve the level of transparency. When consumers choose healthcare, they have very little information about the outcomes that affect them. How long will they be away from work? Will pain be well controlled? What are the chances of getting an infection if this doctor operates on me? If consumers had as much information about healthcare as they do about consumers' products, we will see significant improvements in quality and a reduction in cost. If consumers, employers, and insurers had access to this data, perhaps we would begin to reduce inequalities and margins in quality of service provided by different healthcare organizations. When you buy a plane ticket, does it ever come to you to check how safe the airline is. Now, science security is guaranteed. The airline industry has instituted safety practice so that all airlines are safe. You choose your ticket for the price of the service. This is how it should be done with health service. Part of this is being transparent about that we are doing right and where we are failing. Understand the difference between the genders. If you pay attention to American medicine, a better term to define it will be standard medicine of American men. When you go to emergency room, complain of chest pain and have blood draw to access whether you are having a heart attack, the blood endings test used used is standard for men and does not recognize 20% of patents. Heart attacks in women. This is despite the fact that for years ago we have known the limits of women and men. With these enzymes, it is also another public exam. The FDA, Food and Drugs Administration, had the data 20 years ago when they approved the drug that they too should be lower for the women. The FDA could recommend dose for women in half in this year. We are just talking the first step of understand the difference between the sexes in relation to common important diseases. Some of them are already known to use such as the enzyme in the blood. To identify heart attacks, it is necessary to establish different limits. Promotion of better health habits. In the 20th century, we saw enormous advance in the area of health due to improvements made in public health, such as ability of clean water, the consumption of nutrifood, vaccine, vaccinations, and the development of antibiotics to treat infectious diseases. I believe that we will have the best advance in health in the 21st century if we improve the health habits of all peoples. In other words, we must encourage people to exercise regularly, have annual checkups, vaccines their children, and reduce tobacco use. Today we see massive outbreaks in the country because parents have misinformation that links vaccines to vaccines. People need to be better informed about how exercise prevents or controls diabetes, obesity, high blood pressure, and other health problems. Reward primary care. I will have a system much more focused on primary care than on specialist care, and it will reward primary care doctor who prove effective in keeping patients healthy rather than doctors dealing with last minute solutions in the latter stage of chronic diseases. Currently, the opposite is true in the United States. We reward doctors who use the most scientific technology rather than the most basic technology. So, if a person suffers a heart attack, for example, they say, "Who look? You go to the hospital with treated you use in time. We have a cardiologist and an interventional radiologist who are going to have a stent. The patients say they saved my life. This cost much, but the patient may have a primary care physician who which the right disease could have heart attacks prevent. We lack bank and other countries in Europe and Canada. On many of these experiments we are behind, even though we spend twice almost as they spent. Make hospital safer. We have huge problems with patient safety. A lot of mistakes are made, a lot of accidents, myths, and infections happen in American hospitals and other healthcare facilities. More than 500 people die every day from errors or accidents in hospitals that can be prevented. This is equivalent of is the entire population of Miami dead every year. The product of the work in rating hospitals for their safety is called the hospital safety score. And from it we know that some hospitals are safer than others. This means that these hospitals have to prioritize safety. All information indicates that leadership and culture are essential elements for safety. I want every CEO of a hospital in the country to put safety at the top of his list of priorities. Thanks for pay attention and goodbye.